Welcome back to iGen Politics. This is a podcast that makes politics engaging and relevant for all generations. This is Victor Shi.
And I'm Jill Wine-Banks. And for all of you who have been watching this show, you know that I am the person who wears hashtag Jill's pins. And today's pin is really big, so I know you'll be able to see it. And it celebrates gay pride and the LGBTQIA plus community.
Yes, language and words matter, especially when it comes to how we talk about marginalized and underserved communities, given all of the ways that the LGBTQIA plus community has been attacked and is attacked right now, especially in Republican states. Jill and I are joined by a guest who will help us better understand how we can understand and talk about the LGBTQIA plus community in the best way possible by using the right words and language.
Yeah, words really matter. And to help us do the right thing using the right words, we are joined today by Randi Ettner, a clinical psychologist known for her work with the transgender community. Randi is the founder of New Health Foundation and has helped pass anti-discrimination laws to help the LGBTQIA plus community. And I hope that there's some other way to refer to the community than all those letters, and has provided testimony on behalf of trans people seeking workplace rights. We are grateful, Randi, to have you join us today, and we look forward to the conversation.
Well, I'm delighted to be here and to be able to talk about this most misunderstood area of human behavior.
So, on that note, we want to dive into these terms. And as Jill was saying, there are so many different terms and I guess phrases in the LGBTQIA plus community. But, first, I guess we've been saying LGBTQIA plus. Is that the most inclusive overall term based off of your experience?
Well, it certainly is a lot of letters. And I imagine that we could even add more if we thought about it. But I think that basically we know what we're talking about. When you use those letters, we're talking about a community that's been targeted, that has been discriminated against, a small minority, and these laws that are now being passed are making it so difficult for people to live everyday lives safely and comfortably, with, it seems, the intent of just erasing this transgender population altogether from society. So what does the term transgender mean? It's really an umbrella term that covers a scope of people. And language and words are important. And, I don't know that we're covering every single identity when we use those letters, but we are certainly capturing people who are intending to express themselves in their own unique way.
So what I want to focus on, and I do want to get to your psychological expertise as well and talk about that aspect of it, but I think we have to define things before we can talk about the psychological aspects of this. And you've just referred to the T letter in the LGBTQIA plus, which is transgender. And Victor and I spent a lot of time talking about how we would phrase questions, because we both really want to know and be educated. We want to be allies. And we weren't getting the questions that we were getting because all of the words mean. And so I want to start, because I'm just assuming this is an intergenerational audience. There are many people listening who are Victor's age, and then there are people my age. And I am sure that there are many, particularly at my end of the spectrum, who don't know. So let's just go through the list. And when you say there are other letters that could be added, I would like to know, again, what those are. To me, L means lesbian, B means bi, G means LBG, gay.
Thanks a lot.
Q is queer. LGBTQI. Okay, so I'm not even sure is I intersex, or what is the I?
Intersex.
Okay. A. What is A?
Well, that depends on who you ask.
Okay. Give me
So-
some options
so-
here.
A could be asexual.
And what does asexual mean?
It's an individual who is not engaging or interested in having intimate relationships with another person.
Okay.
Okay.
And so the plus stands for all the other possibilities. But before we get to what the plus is, maybe you can explain the difference between gender, gender identity, sexual identity, sexual preference. If you could address that, I
Sure.
want to make sure we're using it correctly.
Right. So, Jill, everyone has a gender identity. We have a sense of belonging to a group, typically female or male, or another category, and it is a deeply felt internal sense that everyone has. For some people, that gender identity, that sense of who we are, doesn't match the sex they're assigned at birth. So at birth, the physician gives a cursory look at the genitals and writes F or M on the birth certificate. And for the majority of people, that F or M is aligned with how they view themselves. But for some people, there's an incongruity. And for those people, the incongruity between their gender identity, their view of themselves, and that sex they're assigned at birth can be extremely distressing. And that is called the umbrella term of transgender, when there is that incongruity. Sexual orientation is who we're attracted to. And transgender people can be attracted to, just like non-transgender people, they can be attracted to males, females, or other people, or any gender that they find attractive. So sexual orientation and gender are different constructs. They really are.
Is gender heavily related to what in my day I would have called the stereotypes? A woman is more compassionate, a man is stronger, which I consider to be stereotypes, not based on individual circumstances. Is that what gender is?
Well, that's what gender role is, and that's very culturally based. So do you remember years ago this idea that there was a Mr. Mom, the man who stayed home while the wife worked? Remember that?
Yeah.
Well, we would have said that he was perhaps acting as a woman would typically act, but his gender was male. It didn't change his gender.
Right.
So gender presentation is how we display our gender. Gender role is the activities or the performances that are typical in a given society or culture. And there are stereotypes, as you say, absolutely.
So I'm wondering, so when we talk about things like LGBTQIA plus and all the different phrases and terms out there, is it the community or the medical profession? Like, who decides on what the terminology should be and is?
Well, I think it's the community, and I think the language is evolving constantly.
Yeah.
I mean, it's just probably changed last night while we were sleeping. I mean, if you look on the internet,
Yeah, there's a lot. Yeah.
Gender awesome, and we talk about gender non-conforming, gender queer, gender fluid. People have an individual way of expressing their identity.
Right.
And really, identity is so central to personality. This is not a trivial, identity is not trivial. I want to just share with you an interesting research project. here in Chicago, someone studied patients who had end-stage Alzheimer's. They lost all their cognitive abilities. They didn't recognize their relatives. They were really at the end of their illness. And yet, when the nurses talked to them as though they were children or used baby talk, they got very agitated. Why? Because they retained the identity of an adult. They retained their sense of identity as adults. Nothing outpaces identity. Nothing outlives it. Identity is really a very central aspect of who we are as human beings.
And so that, I guess, raises the question of how do people decide who are assigned male or female at birth? And as of this time, those are the only two genders that are identified on a birth certificate. And it's based, as you said, based on what genitalia the doctor observes, or the nurse or whoever fills out the form. How do people then say, no, I feel like something different. I'm not comfortable in this skin?
Well, that's exactly the feeling that some people have. And some people have it very early on. So we hear of children who feel as though, they call me son, but I feel more like daughter, who really will, even before they can express that idea, they have a sense that something is not right. They don't feel like their peers. Now, for some people, that occurs later in life. For instance, remember when people heard about Christine Jorgensen?
Yes, I do. Victor, do you know who that is?
I don't know.
Go ahead, Randy.
Well, that was the first person who in the 50s, I think it was the late 50s, she had been a GI. She had been in the Army. And she came as a man. She was born male, enlisted, or was drafted as a man, and became a woman, having had some of her surgery in Europe, in Denmark, actually. And for people who saw that, for some people, it was like a lightning bolt. They were like, oh my God, now I understand why I have felt this way my entire life. So she was really the first person to publicly transition and to bring this awareness to the public. But this is not a phenomena that started with her. I mean, this has gone on throughout history. Ovid, who was a first century poet, talked in prose about the stuff from a pregnant mare. Premarin is a drug today. It's an estrogen compound, and it's made from the urine of pregnant mares. And Joan of Arc was a trans man, burned at the stake in part because she wore male clothing. Oh. So this isn't a
really
new phenomenon. Yes.
Wow.
Boy, I didn't know that. So Joan of Arc, I always picture her dressed in female clothing and being burned at the stake in female clothing. But
well, according to some history books, there is verbiage that says that you have insisted on wearing the robes, the clothing of the men, and on, indicating that, in fact, she had this condition of gender incongruity.
Well, she certainly behaved in a gender, at least by society standards, because of her fighting and her standing up for what she thought was right. So that would have not been the role assigned to females at the time.
So at the very least, she was gender nonconforming.
Yes, but that goes on. I mean, I'm gender nonconforming. When I went to law school, only 4% of all lawyers were women. So all of us were gender nonconforming and faced those issues. But and that certainly has improved as of today in terms of the acceptance. Victor did some research. Why don't you ask about this, Victor? I thought this was very interesting.
Well, yeah. So, I mean, speaking of all the terms and phrases, I mean, I read about this one acronym, SOGIESC, which stands for Sexual Orientation, Gender Identity, and Expression, and Sex Characteristics. Can you define what some of those mean for our audience? And would you say that all are socially constructed, or is there some sort of biological or physical explanation for all of those?
Well, there appears to be a neurodevelopmental basis for gender dysphoria. So let me define gender dysphoria. That is the most extreme or the most severe form of the gender incongruity that we've been talking about. So when a person feels that this disconnect between their gender identity and this body that they've been born into is so distressing to them that they simply can't manage. They develop anxiety, they develop depression, they may isolate. Some may attempt suicide. That is a medical condition, and those people will require medical treatment, often hormones, and some will require surgery. So researchers have looked at many different brain aspects of the brain to try to determine what gives rise to this. And they've actually seen differences in the brain because with functional magnetic resonance imagery, all of this new technology that we have, we can look at people's brains. And researchers have looked at these brains and they have seen differences in certain areas of the brain. And we also know from twin studies that twins, even those who've been raised apart, have a higher concordance of gender incongruity. And a sibling is 5 times more likely, a sibling who has gender incongruity, gender dysphoria, is 5 times more likely to have another sibling who also has gender incongruity than in the general population. So there seems to be a neurodevelopmental or a biological basis to the condition, which is important because it means that it's not a lifestyle choice. It's not a phase that people can be talked out of. Psychotherapy is not going to change someone's gender. And so if you think of this as something that a person is born with, then it becomes a condition, a medical condition that fortunately is treatable.
That's so interesting. And do you think that research will become more widely known and be grounds for the arguments against the, for example, gender medical treatment, which is being barred in states now, particularly for those who are under a certain age? Do you think that if this research were more widely known, that legislators might step back from that and say, ooh, this is a medical condition that needs to be treated? And that could help. I mean, I have friends who have trans children, and one of them was extremely unhappy and depressed, and since transitioning has become much happier, and which makes sense with what you're saying. So talk a little bit more about this medical study.
Well, Jill, I've been an expert witness in many cases, and this is what we always present, this evidence. And many of these cases are cases where people are incarcerated. And as you know, the Eighth Amendment prohibits cruel and unusual punishment, which the courts have interpreted to mean withholding necessary medical treatment.
Wow.
And so on that basis, we have gotten care for people who've been incarcerated. And it's based on that research. And there is an assemblage of that research. That research is growing, although in these red states that are now fighting access to care, they debate that, of course, or they deny that. And we have, unfortunately now, as you know, politicians who are making medical decisions. And not just in this area, but I mean, we saw it with COVID.
Yeah.
And with reproductive rights. And now we see it with denying care, gender affirming care to transgender people, to people who require it.
In states that are still open, what advice would you have for parents? Because I've read some about that if you go through the hormone treatments, pre-puberty, puberty blockers, that the transition is more likely to be successful, that if you wait too long, there are complications. So what advice would you give to parents as to, number one, obviously if you could do a brain scan and say, your child is got all the brain symptoms of someone who is gender dysphoric and needs hormonal treatment. That would be maybe an easier thing. But until that's proven and widely available, how do you help a parent say, yes, my child is truly ready for this life-altering treatment?
Well, first of all, Joe, we don't do any surgery or irreversible treatments, no treatments for children. But the laws are now fighting treatments for, young people, not children, but young people, youth.
What is the definition of children and young people?
Well, prepubertal children are, in many cases, in need of these puberty blockers. And what happens in those cases, and what must happen, is a very thorough assessment by a multidisciplinary team of people who have expertise in working with youngsters. So while politicians are saying that this is experimental and damaging, I'm going to quote Scientific American, which says that to consider these treatments experimental is cruel and unscientific. But youngsters do need counseling. They do need, and parents do need to be involved and certain and supportive, and to know that this is that any kind of intervention is appropriate and is appropriate for their child. And so this is why this is something that is very thoroughly considered in a multidisciplinary setting. And under those circumstances, the results can be excellent.
So,
And to deny that treatment, parents are going to have to leave the state, and providers are going to have to leave the state, because some states, as you know, will make it a felony, the provision of that care.
Yeah, I was thinking more in terms of the parent, assuming you're in a state that allows gender affirming care, how a parent makes that decision and at what age is the best age to make that decision. Are you better off doing it? I have talked to people who say that at almost as soon as the child could talk, they knew that they didn't like being whatever gender they were assigned. And so at what age do you start saying you are capable of making that decision or of knowing the consequences of that decision?
Right. Well, like all of medicine, this is on a case-by-case basis. And some children are mature earlier than other children. And some minors are very mature and are capable of giving informed consent or participating in healthcare decisions. But I think it's really a case-by-case basis. But typically, children who know very early on have the most enduring and most long-standing gender dysphoria. And those are the children that most likely will end up receiving treatment. The parents are aware of it at an early age, and it's just intractable in some children.
Mm-hmm.
And it sounds like that's what you've seen in your friends' children.
Yeah. Well, I think most of my friends' children have transitioned at a later stage, college or later. But I have read about children who knew. I read a review of Elliot Page's book, and we are hoping to have Elliot as a guest on the show. And he claims that he knew very early in his life. And so it'll be very interesting to speak with him. I want to go back to, if I can, unless Victor has a question, I want to go back to the language thing, because it just was occurring to me that LGBTQIA mostly refers to sexual orientation. Is that correct? I mean, lesbian is, I believe, defined as a woman who is interested in sex with a woman. Gay would be a man who's interested in a male sexual partner. Bi, as opposed to being gender descriptive. Is that correct? And do we need something that defines gender descriptions?
Well, I think you're right. And I think part of the reason that transgender people have been targeted is because, unlike the gay, lesbian, bi community, oftentimes they're visible. We don't always know what a person's sexual orientation is, but people who require medical treatments or who transition and want legal recognition become visible. And that's why they are so, in a way, vulnerable, because they require something that the other members of this group that you've mentioned, this, don't require. So people who are gay or lesbian don't require treatments to help them transition or changes in their identity documents. And so even though some of these laws will affect them, they are not as vulnerable as the transgender population, which is terribly discriminated against and really subjected to enormous stigma. In 2008, a survey showed that transgender individuals were 4 times as likely to be living in extreme poverty, twice as likely to be unemployed, twice as likely to be homeless as, compared to non-transgender people, or what we would call cisgender people. And 41 to 43% report having attempted suicide at least one time. So this is a very vulnerable population.
So I want to come back to that, but I think Victor has to go to do a work assignment, and he wanted to get in one more question before he left, and then I'll ask you more about the sexual identity, gender role.
Well, I want to ask you about something that Jill and I often talk about, which is pronouns and kind of what pronouns we should be using when describing transgender people, or I guess just different cases in the LGBTQ plus community. Can you talk about the pronoun usage and specifically maybe any alternative to their? Jill and I, we were talking last night. I mean, sometimes we find that there is confusing, especially if it's referring to a single person. So like if they are coming for dinner and then you ask, how many plates do I set, but it's really referring to a single person. Can you talk more about kind of that? And if there's a solution to, or another word that can describe there?
Well, they, them is a very commonly used pronouns by people who consider themselves non-binary.
Mhm.
And they're a smaller group of people than the transgender population at large. And those people don't perceive themselves as being either really male or female. It's somewhere other than the binary. They reject the binary of male and female. And language and law is very binary, but humanity is not.
Right.
As someone once said, nature loves diversity, but society hates it. And it's true, isn't it?
That is, yeah.
So people who use these pronouns, and we have to ask people what their pronouns are. We can't automatically determine that. Often will use they, them. And I think it can be confusing, and it can be something that many people aren't used to. But it is something that I think we have to be respectful of. And I don't know that there is a solution per se, but I've read that some people are saying that rather than the plural them, like I'm inviting them to dinner, they will use the person's name. So it will be so-and-so is joining us for dinner.
Right.
Yeah.
To make it clear that we're talking about one individual and not a plural. I know
It's confused. It happened to me recently where my grand goddaughter was referring to one of her roommates, but by the term they. And so I thought she was referring to all of her roommates.
Oh.
And
Yeah.
it was just to one of them. And using the name would have helped. That is a good solution for those things, so that I think both sides have to be open to this. I'm certainly open to it. It was just I was thrown off by when I found out that they was only one person.
Right.
So all right, Victor, you have to go, and
Yes.
we'll just
Randy, thank you so much for
continue for a little more. And
Hi, Victor.
so back to the gender versus sexual orientation. So a trans man could either be a former lesbian who remains interested in female sexual intimacy, or could continue to be interested in males. Is that correct or not correct? Or how often does that happen, one way or the other?
That's correct. That transgender people, just like non-transgender people, can be attracted to females or males or both, and that is independent of their gender identity.
Mm-hmm.
So a trans man could be attracted to women, and many trans men are and marry and when possible, or they could be gay, meaning they're attracted to men because they are men.
Right. So let me ask you another question, which is, in terms of language, I've tried to be inclusive. So in referring to the abortion debate, I speak of people who could become pregnant because that could include a trans man who still has ovaries. And there has been some pushback that that's ridiculous and some praise for being inclusive. What does the community in general, if you know, or do your clients feel about inclusivity in that regards?
Well, that's an interesting question, because I think that every person is different. Every client I see is different. And so I don't really want to speak on behalf of the community, but I think that, certainly people who do have a uterus and ovaries can become pregnant. And it would involve going off testosterone and for a period of time. And that we know that has happened and does happen. And I imagine that there are people that would really be very delighted and just be thrilled that you would actually be respectful enough and enlightened enough to understand that a person who has transitioned could have a child, and that transgender people, like all people, some people very vehemently do want to have children. And that's, a hope that many people harbor, transgender people too.
Okay, so also in terms of helping me to understand, what is the difference between non-binary and gender fluid?
So a person who identifies as non-binary would be someone who says, I don't really feel totally female. I don't really identify as a woman, nor do I identify as a man. I'm just who I am. I'm just my own. I'm, as unique as a fingerprint. That's my identity. And someone who's gender fluid is someone who feels that they can actually move from one gender to another at different times. Sometimes they feel very female, or so I've been told, and sometimes they feel masculine, but they seem to express the feeling that their gender is fluid and not consolidated as male or typically female. And I do think, Jill, that only really refers to a very small group of people. I don't think a lot of people would identify as gender fluid, but there are certainly some that would and do.
I have friends with a gender fluid child, so it doesn't. And okay, also on words, is there a difference between woman, female, male, man, or do they have the same meaning and connotation?
Well, I think one is a noun and one is an adjective or an adverb, right?
Well, so, I don't know. I am a man. I am a woman. I am a female. I am a male.
Well, right.
Male seems like gender to me. Woman, I don't know. I mean, I just don't know. Maybe they're the same thing.
Well, man and women only refer to human beings, whereas female and masculine can refer to mammals. So we can say a female cat, but we would never describe a cat as a woman.
Yeah, that's true. Okay. All right. And
someone has female sex characteristics, or has a feminine presentation, but man and woman are only referred to human beings.
Okay. And are there any insights that you could share about how a person knows that he or she wants to transition or to identify differently than as a binary male, female?
How does one know?
Yeah.
Well, I would say that some people who grow up in resource poor families, and this is something I've seen in the prisons because I do a lot of work in the prisons as testifying as an expert. Some people who get into prison have never been exposed to even anyone who's been gay or transgender. Maybe they had a very, impoverished home life, or they had a very strict religious upbringing where those subjects were never mentioned. And then when they're in prison, they suddenly learn about these different aspects of life. And they realize, oh, well, that's how I felt my whole life. That's the pain that's been dogging me all along, but I didn't know there was a name for it. I thought I was just weird or damaged. And, when I first started working in this field, some people would come as patients, and I was the only person they had ever told. There was so much shame about this. There was so much guilt. And it was just, sometimes they couldn't even bring themselves to disclose it to a professional because it was, what did I do wrong? Why? Even the people who have the condition often don't understand it. And so they're very, now with the internet and with social media and with resources, people are finding that, oh, there's doctors that can help me with this. I never knew that before. So the internet really brought in a complete tectonic shift in this field.
Although I would say it also has created a lot of hatred, and that's expressed openly, the kinds, and has led to many states passing laws that are hateful and terrible. The attacks on the trans community particularly, but just the entire LGBTQIA plus community have been subjected to terrible new laws, terrible discrimination. And so there is some good with it. But, I have to say, I've never thought about the community in prison. Let's stick with just trans for now. Where would a trans man be housed? In a female facility or in a male facility?
Female facility.
Female. And how dangerous would that be? And vice versa for a trans woman? How a trans woman then would be housed with a male facility?
Very dangerous. It's a minefield.
So what protections are they offered? Very
few, very little. We know that the sexual abuse, the horrific treatment in prisons is, it's really can be just not just from other prisoners, but even from correctional staff.
Yeah.
It's just it can be just absolute hell. People are housed based on their genitals. And even people who have transitioned and have had partial surgeries, if they have male genitals or female genitals, they are housed based on those genitals typically. Prison is a very, just a dreadful experience for people who are transgender, and particularly people who require health care. Access to health care can be excruciatingly difficult.
Is that true outside of prison as well, that trans people have difficulty getting medical help?
Well, one study said that 26% will postpone care because they're fear of discrimination. They're less likely to go for preventative screening kinds of treatment. They experience discrimination in physicians' offices. And now we see that some of these states are proposing laws that would ban gender affirming care even for people up to the age of 26 who are not minors, but adults.
Wow.
Yeah, and that Idaho is proposing a lifetime imprisonment for providers who give care to youth.
Oh my goodness.
So these laws are so harsh that providers, parents, patients actually have to leave the state. There have been 500 laws, anti-transgender laws, just this year that have been proposed in 49 states. And that's more than in the past 5 years combined. 77 have already passed into law. They've been passed. So this is really just a very cruel political strategy to really scapegoat this population.
Well, this has been very informative, and I hope that the medical research gets publicized more, because I think when people see it as a physiological, biological component, as something that is immutable, that it may help with acceptance, and that would be a good thing. Are there any questions I didn't ask? I hate asking a question like this because I know I hate getting it, but have I missed anything that you think our audience should know? Any misconceptions or terms that they should know? Or are there terms that they should avoid? I mean, queer, for example, is a word I would have never used. It would have been horrible, but now it's one of the words that the community has embraced as representative of certain elements. Mm-hmm. So I just, again, it's, are there words I shouldn't use? Are there words I should use? Are there any other information besides this amazing medical information that I should know?
Well, we've abandoned the word transsexual because unfortunately that conflated sex and gender. And we've abandoned the term sex reassignment surgery or sex change. And we have instead gone to gender affirming care and gender affirming surgeries, because we're not really reassigning people's sex.
Right.
And I think that what's important is just to understand that people are born with a gender identity and that it's not something that they've adopted as a lifestyle choice, and that in certain cases, in the case of severe gender incongruity, it's actually a medical condition, mm-hmm. and it requires treatment. And therefore, we should give the same health care to people who have this condition as people who have diabetes. And we don't.
Well, thank you for joining us today. It has been a great education for me, and I know it was for Victor. I'm sorry he had to leave early, but we'll have to continue this conversation, because I'm sure that if our audience has any questions, they will send them to us, and maybe you will be willing to help us answer those questions in a medically sound, psychologically professional way. So thank you for your time today.
Thank you, and I would be delighted to do that. Thank you, Jill. It's been a pleasure to be here with you.
Thank you. Bye.
Bye-bye.